All right, so welcome everybody to the second event of our series, A Peek Behind the Curtain, which is where we look at current events in medicine and learn more about them. Really excited to have Dr. Smith and Dr. Key with us. So Dr. Smith is the Chief Health Affairs Officer for UTC, there's a C in there, and she's also a UC Foundations Professor and the Director of the School of Nursing. And then we have Dr. Yasmine Key, who is a nurse practitioner and the director of the University Health Services. So we're super excited to have both of you guys here. Thank you so much for your time. And so we're going to start with the first question, which is for Dr. Smith. So how have vaccines changed medicine?
I unmuted. I didn't do it. How have vaccines changed medicine? Well, it goes back to the year 1000, actually, when the first vaccines came about over in China. And what they've done actually is they have developed a way to protect us from some pathogens, some viruses, and some bacteria in certain instances that would cause a very negative outcome, death or some kind of ongoing medical condition. So they have prevented something that without the immunization or the vaccination, we would still be prone to be exposed to over and over again. And we've seen over time that a lot of these are lethal. So it's really been very positive.
Awesome. So again, Dr. Smith, next question for you. So can you give us some background on vaccines? We hear a lot about live versus dead virus vaccines. What does that mean?
Okay, good question. And I did some research on all this because I could have given you my, 1 to 2 sentence answer, which would be very, 40,000 foot, but I did some reading about it. It's really kind of fascinating. And I don't know if you had to take Latin when you were in high school. I did. I took 3 years of Latin, and the word immunity actually comes from immunis, which means exempt. So by being immune to something, you are exempt from getting it, which I think is really very, very fascinating. But then I did a little more digging in it, and Buddhist monks actually drank snake venom to confer immunity in 17th century China. And then, a lot of these names that I'm going to throw out to you all probably have heard, Edward Jenner in 1796, he actually inoculated, we all know this story if you had to do any kind of classwork in healthcare, he inoculated a 13-year-old boy with cowpox. And then all of a sudden, over time, the child was immune to smallpox, which really has been a significant healthcare concern for many, many years, up until fairly recently. Then the other famous names that we know about are Louis Pasteur and his experiments with cholera in 1897 in the early 1900s. And then actually there's been a vaccine for tuberculosis, which actually came late in the 1800s, about 1890. And we continued to look at this type of vaccination through the 1950s. And then the things that I remember, because I'm getting up there in my age, was when Salk came up with inactivated polio and Sabin, which was the live attenuated or the oral polio vaccine. And I am really dating myself, but I remember in kindergarten lining up in the hall, and they actually gave me a sugar cube with the vaccine on it, and it was for oral polio. So that was a live virus, and we'll talk about the difference between live and not live viruses. And so over the course of time, there's really been some very fascinating developments. And as the technology has changed or the knowledge has changed, we're getting into some different types of vaccines, which I think Dr. Key is going to talk about. DNA vaccines that deal with viral vectors and plant vaccines, and they're even looking at topical formulations, looking at vaccines for cytomegalovirus and herpes simplex, HSV, and then we already have the one for respiratory syncytial virus. That's something that mothers are very concerned about with their young children, and we have a vaccine for that. And then, of course, I know Dr. Key is going to talk about flu, Shigella, HIV. That's all in development. So there might be a vaccine for HIV. And again, I was working in healthcare when, in the early 80s, when the first case of HIV was identified, and everybody immediately went into panic mode, and we were all trying to figure out how to deal with this new virus. And now they're talking about a vaccine against it. So it's really, really fascinating. So what's the difference between live and non-live, or dead vaccines, as we call them? Live vaccines actually are a weakened form of the virus or the bacteria, and it causes the disease or the illness. And they're very similar to what we experience. So they help to prevent, they help create long-lasting immunity, which means exemption, remember our Latin. And usually just 1 or 2 doses of that vaccine gives us lifetime protection. So let's think about measles, mumps, and rubella. When you're a mother or a parent of a young child, the young child is immunized at, I believe it's 12 months, and then again at 4 years. And then every once in a while, especially in the healthcare professions, we test for immunity. So we've had students in our nursing program who no longer show immunity to measles, mumps, or rubella, and we give them a booster. Most people don't have to have a booster, some do. So that again is a live vaccine that we're injecting into the body, and it goes through the very complicated process of developing an immune response. So that's one kind of vaccine, the live vaccine. The other one is an activated vaccine, and it is actually, they take a portion of the virus or the bacteria that is no longer alive, but they still inject it into the body, and then you get protection. This protection usually doesn't last as long as the live attenuated vaccines do, and that's why we have to get booster shots over time. Now, remember, there are 2 types of flu vaccine. There's the live vaccine, which was the intranasal that we offered on campus, and then there's the flu shot. So Dr. Key, I'm sure, will talk about why we need boosters, but that's an example of that. Another inactivated virus can be polio, although polio is almost eradicated on the earth, rabies, and hepatitis A.
Thank you.
You're welcome. It's very fascinating. Thank you for making me research it.
I think all this is really interesting too, so I'm excited that we're doing this. So 3rd question for you before we jump over to Dr. Key. So are vaccines dangerous? We hear a lot of people claim they cause health issues, they can give you the virus that you're being vaccinated for, or contain poisons. So is that true? And if not, why do people say that?
You're asking me, and I'm going to tell you no. But however, overwhelmingly, the research and the evidence from medicine shows us that the negative side effects, which are localized reaction and sometimes an anaphylactic reaction, are very rare and minor. And sometimes if there is a true anaphylactic reaction, it's usually due to one of the components that is in the immunization itself. Now, we just don't shoot straight virus into you. It's in a medium. And sometimes that medium is a little bit different. And so I don't know if you've had a vaccine lately, and we'll ask, are you allergic to eggs, or are you allergic to the thimerosal, which actually I ask people, can you use contact lens drops? That's thimerosal is that. And if you are allergic to either one of those, we will be injecting that into your body. So you might have an anaphylactic reaction, which is the absolute extreme. So that's why it's so important when you go get like your COVID vaccine, or you get a flu shot, or you get any of those. One of the things that the CDC requires us to do is to ask about allergies to certain components of the vaccine. So yes, they can be dangerous. Can they kill you? Yes, but it's usually because it's one of the components that's in the vaccine itself. Now, the problem is we've gotten some bad publicity over the course of time. And again, personal opinion, I don't want to inflict my opinion on anyone else because I feel very strongly about vaccination. And unfortunately, there are a group of people out there that feel like autism is tied to vaccination. But when you really look at the evidence and the immunization programs that have been out there for so long, when these children develop autism spectrum disorder in particular, it's about the time that they're getting vaccines. So if we did not vaccinate them, there's a pretty significant chance that children who were prone to having autism would have developed it anyway. It's just kind of a perfect storm. The immunizations up until age 18 months to 2 years is pretty routine. I mean, you get immunizations as an infant at 2, 4, 6 months and 12 months, and then at 18 months and 2 years. So that's 6 times in 2 years. So it just is kind of the perfect storm. There's been a lot of research on it. There are a lot of groups out there, one side or the other. We still have that conversation going on right now. And the best thing I think for everybody to do is to do their own research and make their own decisions. The long-lasting effects of not having a polio vaccine or a measles vaccine or a diphtheria or pertussis vaccine is much more dangerous than having the immunization itself, because those diseases can have very negative outcomes for children and adults as well.
Thank you. All right, Dr. Key, you're up. Our first question for you is why there is such a vaccine hesitancy, particularly for the COVID shot, and why should folks not feel afraid about getting vaccinated?
I think it's important to first talk about what is vaccine hesitancy. There's a lot of terms that are kind of thrown around about vaccine acceptance. That's another one that you might hear. Vaccine confidence, vaccine willingness, and then vaccine hesitancy. I think that's probably been the most publicized one, particularly related to COVID. So it might be the one that you guys have heard the most about. But essentially, if I want you to think about it as like a continuum. So you've got from a vehement refusal to a demand to receive the vaccine. And you probably have seen those in your social circles or professional circles from somebody that might fall from one end to the other or anywhere in between. I'd say the majority of people fall somewhere in between. There may be some questions that they have that they want answered. They may want to wait and see what happens for other people who get the vaccine first. There may want, just additional validation from a specific healthcare provider or from a peer that they appreciate and value their opinion. Or they just may want to wait until they have access and then they make a decision then. So it may be that they're just, thinking through the process and trying to process the information that's available. So there's quite a span. And so I think it's most important for us as healthcare providers to understand why people may say that they're not necessarily willing to take a vaccine, whether it's a COVID vaccine or any other vaccine, at the time that something like that is offered to them. And these are the kind of conversations you really want to have in advance of vaccine availability. If it's a flu vaccine, these are conversations providers should be having all the time. If somebody's pregnant, it's something that their provider should be having with them about their child or about the vaccines that might be required while somebody's pregnant or before somebody gets pregnant. Those are the kind of things that need to happen on a very regular basis, not just in the moment that it's available or in the moment that it's needed. Well, so specifically, we'll talk a little bit about the COVID vaccine. So we have to instill vaccine confidence that is grounded in evidence for the population. So it's important for us as healthcare providers, healthcare professionals, or experts out in the community to be sure that we are providing accurate, current information for vaccines that are available now and vaccines that are kind of coming down the pipe. Because it's true that the confidence that the public has in healthcare providers is significant. And so it is a heavy responsibility for people who have this kind of information to make sure that it's consumable and understandable for the general community. So back in October, there was a poll that was done about whether or not people would receive the COVID vaccine, should it be available? And only about 58% of the general public said they would take a COVID vaccine at the time. And the different things that they said that weighed on their decision was they were concerned about what might the side effects be if it works, is it safe, and how much does it cost? And so all of those answers are really coming to fruition now that we have so much vaccine coming to the forefront of availability here in the United States. We know a lot about the side effects. We know about how well each vaccine works. We know about the safety profile for these vaccines. And we know that it's available to people for free at this point, not only for the vaccine itself, but for the administration as well. But we have a challenge ahead of us about vaccine acceptance. We hear from these people who have concerns about it. If their healthcare team says it's safe, they're a lot more willing to say, great, I'm definitely willing to consider it. They're much more willing to take it if it doesn't come at any cost to them, which is what the United States is providing at this point. If it helps us get back to normalcy, to normal school or work routines, they want to take it. And if they can get it easily, which has not always been the situation here in the United States, it's still not the situation. It's not easy to get right now necessarily. It's getting easier, and it will get easier over the coming weeks. And we can talk about that in a little bit if y'all want, but it's definitely something that's out there. So it's important to understand the concerns. So there are other variables that can really affect vaccine hesitancy. It can be from somebody's ethnic or cultural background or education status. There's a lot of misinformation out there where different cultural groups or different ethnic groups or different races have concerns about vaccines and medical treatments that maybe other groups might not have. So it's important to be sure you understand the specifics behind your patients or your family member or your friend to make sure that they're getting what they need. There was another study that was done in December, a survey really, not a study, that 46% of Black adults said they would probably not get vaccinated for coronavirus, compared with 30% of white respondents. So there's quite a disparity there, a racial disparity there in vaccine acceptance. So there are a lot of things that are really important for us to be sure we're addressing on a gamut of scale. We need to know why somebody's hesitant. Asking them, what have you heard in the community? May I ask why you have any hesitations? And trying to address things from people's perspectives. We're not saying like, why don't you want it? The way that we approach people with understanding their rationale will help us to feel more approachable, to have conversations where people don't feel like it's judgmental, because we don't want it to be. We want it to be a conversation where they feel empowered to share their thoughts and feelings. Counteracting misinformation is huge. It is particularly huge for COVID vaccine, and it is huge for other vaccines, but other vaccines seem a lot more widely accepted now because they've been around a lot longer. But counteracting misinformation is huge. COVID vaccines are not going to make you sick with COVID. There's no live virus in them. That it is and we'll talk about this in a few minutes, but it is an antibody response that builds up because we are stimulating the immune system. So that is how that happens. So that is not going to make you sick per se with COVID-19. If you've had a COVID-19 vaccine, you are not going to test positive on a COVID-19 test. That is a concern that people have. They're concerned that they might have to end up getting isolated because they test positive because they think that they've had the vaccine. If you test positive after having a COVID vaccine, it's because you have the virus itself, not because you've had the vaccine. If you've had COVID and recovered, do I need to still get the vaccine? Yes, the answer is yes. The experts are saying yes. Now, there is some new research out there that says maybe we only need one vaccine if you've had COVID before, but right now the recommendation is still to get a full dose series. Will it protect me from getting sick from COVID if I get the COVID vaccine? Potentially yes and no, right? So yes, you could absolutely, it will help you from getting very sick with COVID-19, but doesn't necessarily keep you from getting COVID-19 altogether. So I think that's a tricky one to make sure people understand it well. There is some rumors about whether COVID-19 vaccine will alter your DNA. It will not alter your DNA, and we'll talk a little bit more about that in just a few minutes as well. And is it safe to get the vaccine related to if I want to have children one day? Is it going to impact my fertility? That's a huge, huge question out there for lots of, particularly our college student population, our traditional college student population. and our high school students who might be eligible for the vaccine at 16 years old for one of the vaccines that's available. That is a big question for them. Is it going to impact my fertility? Yes, people can absolutely still get the vaccine, and no, they don't think it affects fertility. There are even OBGYNs who are recommending it for their patients who are pregnant who have high risk COVID exposure. So talking to their healthcare provider, making sure that they really understand what is real information out there and what is not. I read an article from one of the creators of the Moderna vaccine, and she talked about the risks that are out there for people's misinformation is whatever is floating around on social media that day. And it is very true. So you know what's going on in social media, what articles are trending. Those are the kind of things that people are going to come to you with questions about it. So knowing as a healthcare provider that these were trusted resources, we take that responsibility very seriously. And we encourage patients to make the right decision for themselves. And we just need to give them the right information to make the right decision.
Awesome. My mute button wasn't
May
wanting
I
to cooperate.
interject one comment on that?
Yes, of course.
Unfortunately, in the history of the United States, we have not always had ethical principles that were what they needed to be today. So you all are very aware of the Tuskegee trials back with in Alabama, and those African Americans who were treatment was withheld for syphilis, and they were not made aware. And even after the trial had ended, they were not made aware of the fact that they were in the trial. And there were some devastating consequences other than the fact that it was highly unethical. That mistrust of the healthcare profession still is prevalent today. As of a month ago, I had a conversation with an African American, and the individual said, I understand the logic behind it, but the African American people in the United States still have a pretty significant mistrust of the United States. And it is not that they won't be vaccinated ever. It's we want to wait and see what happens, and then we'll talk about it. So it's a very convoluted issue that Dr. Key addressed very well, but there's also some historical things that we need to overcome to get the the trust back in vaccinations across the country and the world. So I just thought
that is really, thank you for bringing some more context to that, Dr. Smith. The physician that I was talking about, one of the contributing physicians to the creation of the Moderna vaccine, she is a Black American female. And she and some of her other colleagues go out and educate lots of populations, specifically targeting their Black peers, to make sure that the information out there is available and understandable for the general public, and making sure that they understand about this vaccine. Because she does talk about, in one of the articles I read, about how there is just such a significant health disparity in people's acceptance of the vaccine. But also, she said, of course, the risk for people of color in general with COVID-19 is significant. They have more adverse health outcomes and higher death rates from COVID-19. So not only is the virus more of a threat potentially for them with health risk factors, but the vaccine could be more beneficial for them because of the reduction in severe illness and the reduction in death with this vaccine. So it's really important to be sure that particularly those populations are educated with trusted information and from trusted sources.
Absolutely. And I'm about to put it in the chat. We do a diversity series for underserved populations in healthcare. Last semester, we looked at African Americans, and Dr. Comiskey, who is one of our history professors, she joined us and did a great talk on the history of healthcare for African Americans. And so that's up on our YouTube channel. And I'll also put our collection of resources that the library put together for diversity in healthcare. So some reading for you as we still can't go out and do things. But on to our next question, which I believe is for Dr. Smith. So what is so special about the flu shot and why should I get it?
There's a lot of special things about flu shots. You're unique every year. And so what they do is the CDC and the World Health Organization actually track what's going on around the world, they say in the Southern Hemisphere. And they watch and see what's happening not in our area. And then they actually determine which top 4 strains are most likely to be causing significant illness. So again, this is why we have to have an annual flu shot, because the strains do not necessarily remain the same. And in order to be protected against the most current strain, you have to have the most current formula per se of the vaccine. So that's why we have to have it every year. Now, remember, there's 2 types. There's the intranasal, which is the live, and then there's the injected, which is not. They both are when they are developed, they cover the same strains of the vaccine. And you'll hear, this year we really focused on, flu A and flu B, and then they have some particular name long behind it. So that's why what's so special about it, it is one of, at this point in time, as of today, the 23rd of February, it is the only vaccine that I am aware of that we create new every year, every flu season. Now, that being said, it's going to be very interesting to see what happens with COVID vaccine, because one, we don't have enough data so far to determine how long our immunity is going to last with our vaccination. And then also the impact on these strains that have changed, the variants that are in our area and in the United States. And what they're saying right now is that particular the vaccine that we have right now, which is the Pfizer, the Moderna, and then Johnson & Johnson is about to come on board. They feel very confident that those vaccines will deal with the strains that we have. But this is a novel, remember, it's called the novel coronavirus. We're not quite sure how it's going to act. We can predict, but we may be wrong, we may be right. So that it might be that one, we have to have an annual COVID vaccine, and two, because of the fact that it's an annual vaccine, that tells us that it has had to, the formula per se of the vaccine has had to change. So the flu, coronavirus, they're all very special because they change and we have to adapt with our vaccination. For the most part, flu causes very mild cases. I remember, you all remember now, 14 months ago, they were saying, oh, COVID is no big deal. Flu kills more people every year than coronavirus can, and that kind of thing. And now we're seeing that is dreadfully wrong. We're over 500,000 people right now. So we've missed that. The flu usually causes somewhat of mild illness unless you have some comorbidities that Dr. Key was talking about, especially in those populations who do not have access to health care. So if you get the flu and you are not in particularly good health, you can develop pneumonia and that may cause your death. So it's really, while the flu changes from year to year, the long and short-term effects of the flu pretty much remain the same. It's still a respiratory virus that can cause respiratory distress and then concerns. So we focus more on people who are over 65, young, very young children, women who are pregnant are very and strongly encouraged to get the flu vaccine in the appropriate time so that they are protected during their pregnancy. One of the things that when I was thinking about this, people say, well, when should I get the flu shot? Is it too early to get the flu shot? It's not too early to get the flu shot. The minute that they put it out there and they say, okay, flu vaccines are available, go ahead and get your flu vaccine. And then the other question is, well, when is it too late? It's too late when the CDC and the World Health Organization say we no longer have flu in this hemisphere. So people will say, well, it's March and I haven't had a flu shot. Should I go ahead and get one? Yeah, you should get one if you believe that, if that's important for you to do. So I think that's all it's special.
Wonderful. I get my flu shot every year. I go to Publix.
Yeah. Were you part of the mess that couldn't get the $10 gift card because they were overwhelmed with the number of people coming?
No, we go early because my
Okay.
husband is high risk. So the minute they advertised it, we were there. So we always get our public subs and then we get our flu shot. So the weird rituals that we have. All right, Dr. Key, this next question is for you. In regards to the COVID-19 vaccine, how does it help protect me from COVID?
I loved this question actually, because it was fun. I got to do a little bit of research on the different vaccines that are available. So it really does depend on the vaccine that you take for COVID. And right now, we only have one type of vaccine available and approved through EUA, so emergency use authorization here in this country. And that's the mRNA vaccines. But there are two other vaccines that are in research right now, in trial, called vector vaccines and then protein subunit vaccines. So all three of these types of vaccines do essentially work in the same way. Basically, it's a stimulation of the immune system to generate antibodies against COVID-19 in order to have the body recognize the virus should you be infected with it and not allow it to overtake our system. And that's what the goal is. So particularly vector vaccines, those are things like we have an Ebola vaccine out there. The Ebola vaccine is a vector vaccine. So that's where you take a genetic material from the COVID-19 virus and you insert it into a weakened live virus, like an adenovirus. There are a lot of adenoviruses, just like there's a lot of coronaviruses that are out in the environment. So you're actually taking genetic material from the COVID-19 virus, plucking it into an adenovirus, and then giving your body the adenovirus, the weakened virus into your body. It serves as a vector. So it's like a ship that goes into your body and then is a delivery system that's getting to your cells. Once it gets to your cells, it delivers the virus. So it kind of unloads it by your cells. And that gives your cells instructions to make copy of what's called the S protein. The S protein is what's really special about COVID-19. It needs to look the same. And so that our body recognizes it when we get infected with the virus. So that's what spurs on the antibody creation that will fight the virus back, if you get it. That's the Johnson & Johnson one that Dr. Smith alluded to. There's also an AstraZeneca vaccine that's kind of down the pike, and then the Oxford vaccine, if you've heard of that. Those are all vector vaccines. So the next vaccine I'm talking about is the protein subunit vaccine. The brand name of, or the company name of the COVID vaccine that's doing this protein subunit vaccine is Noravax. This one you've heard probably less about. This one is a little further down the line. But this is the type of vaccine that you might see for like hepatitis B or the pneumococcal vaccine, or MCV4, which is better known as Menactor or the meningitis vaccine. This is where they take parts of the virus and also they are stimulating the immune system for that. So the vaccine contains the actual S protein, and that's what you're getting. And that causes the immune recognition and response to build the antibodies in your system, and also a white blood cell generation to defend the body. So that's the way that the protein subunit vaccine works. It's a little bit different. You're not traveling in the virus, and you're not like an mRNA piece. So we'll talk last about mRNA with regard to the COVID vaccines, because this is the one that we have right now. So the vaccines that are available right now for Pfizer and Moderna here in the United States, there's a genetically engineered mRNA. So they're not actually making viral particles in the lab. That takes a really long time to do and replicate in order to have enough to provide them for vaccines like a live attenuated virus. We've created a piece of mRNA. So it's an equivocal match to what we would see for the COVID virus. And what that is it's given to us in an injection, just like the other vaccines. And it gives your body's cells instructions for how to make the S protein. It's not giving you the S protein, it's making the S. It's giving your body the instructions to make the S protein. It's like sending an email with directions to your body and saying, hey, this is what you're supposed to do. And then your body is responding by following the directions. So the S protein that's found on the surface of the COVID-19 virus, like I said earlier, is the really important piece to make sure that our body is able to recognize the COVID-19 virus if we get infected by it. So the immune cells make that S protein piece and then displays them on the cell surfaces of the body. And then your body makes antibodies to react to those S protein pieces that it's generated on its own. So then when you become infected with the COVID-19 virus, the antibodies can fight off that virus. So it's not a live virus. Like I said earlier, you cannot get COVID-19 from the vaccine. And the vaccine, the mRNA, you'll see, I've got a video to show y'all in a minute, but it'll penetrate the surface of the cell, but it doesn't get into the center of the cell where your DNA is. That's one of the biggest concerns and myths out there is it's going to alter your DNA. It can't get into the nucleus of the cell to get to your DNA, which is where your DNA is stored. It's in the yolk of the egg. It only hangs out in the white part. And in fact, it dies within a couple hours. Like it doesn't even stay long. It just stays long enough so that your body can figure out how to make the S protein. And then your body does the rest and the mRNA just disappears. It just dissolves into the body. So all of the vaccines that have been made that are available in the United States have been shown to be highly effective at preventing COVID-19. They have gone through trials. You know, people are concerned about the speed of the trials in which these vaccines were made and approved through EUA and have not completed the process for FDA approval yet, because it takes a long time sometimes for these things to go through FDA approval. But a lot of it is paperwork from one box to the next. The reason why it takes longer typically to approve vaccines oftentimes is a financial barrier. The vaccine companies were authorized to go ahead and start making the vaccine as the trials were going on, which does not normally happen because it's extremely expensive. Because what if the trial doesn't go well? Then they have all this vaccine out there that's not going to be able to be used. But because of the need and the urgency of the vaccine for this virus particularly, they said, start making vaccine, make vaccine as much as you can, get prepared to distribute it should this trial go very well. And that's what happened for Moderna and for Pfizer. The trials went very well and showed strong success with this COVID vaccine. And so they said, great, you got it ready for distribution, let's go. And so this is a safer way. Vaccines are a safer way to build protection for your body rather than getting the virus yourself and then building antibodies yourself, because you risk all of these unknown factors that we have with COVID-19. It is a dangerous virus for a lot of people, and we do not know the long-term effects of this virus. People talk about we don't know the long-term effects of the vaccine, but most vaccines, we know the effects of the vaccine within the first 6 or 8 weeks. If you're going to have a side effect of the vaccine, we know that within 6 or 8 weeks. So the trials have been long enough to really know that short-term data that's really important for immunizations. But this virus, we continue to see problems that people are having months after their diagnosis, long haul COVID syndrome or neurological effects or things like that. And so getting the virus itself, most of the time does not outweigh just getting the vaccine and developing your own antibodies from the vaccine. And that's really what the health experts are really trying to educate people on. So, we're looking towards getting immunity, nationwide, worldwide. We want to get immunity not only from vaccinations, but for those people who have been infected, we're hoping that their immunity lasts longer. We do see people who get COVID more than once, and sometimes they're sicker the second time than they were the first time. So we know that even though that's the recommendation for having the COVID vaccine, even when you've already been infected with it, it seems like the vaccine is really helping people to become less sick with it. And that's really what we're going for here. We want to prevent death, and we want to prevent significant illness from this virus.
So our next question is very similar to kind of what we've already been talking about, and that is, what is different about the COVID shot? And can you explain what the mRNA vaccine does?
I would love if you could play that video that I sent you, Teresa. If you could do that, that would be great. Because I did have a really great short video that I found online from Mayo Clinic that I thought would be really helpful. So we'll let you guys watch this real quick.
We've got 2 really effective vaccines from Pfizer and Moderna. These vaccines are about 95% effective at preventing COVID disease. So these vaccines work by delivering some of this mRNA into our cells. The SARS-CoV-2 virus got a genetic code of its own. There's a little segment, a tiny little snippet of that actually codes for this spike protein. The spike protein is the thing that helps this virus get into our cells and infect us. mRNA is like a little recipe for how to make that spike protein. When we get these vaccines, our body makes that spike protein and we develop an immune defense to it without ever having to be exposed to the whole virus. It's not exposing us to the whole virus at all, live or killed. It's only allowing us to make a little bit of that spike protein, which is just a tiny portion of the virus, and then we react to that and become protected from the whole virus. mRNA in these vaccines can only get into the main part of the cell, but it can't get into the nucleus of the cell, which is where our own DNA lives. And it can't incorporate into our DNA. And it also doesn't live very long. It doesn't last very long. It's very fragile, and that's why it has to be stored at these ultra cold temperatures. It's not stable for very long. So it goes into the body, goes into the cell for a matter of hours, and starts to make this protein. Then in the coming days, our bodies react to that protein, but that messenger RNA doesn't hang around, nor does it get into our DNA.
Great. I thought that was a really nice illustration of the vaccine and how it works. I think it puts it in a way that it makes it really understandable. It really even just helped me to understand and visualize what was happening with the vaccine. And so this technology, this mRNA technology is new, but not that new. They have been working on mRNA viruses for more than 10 years, probably about 15 years. With other coronaviruses out there and some additional viruses as well, trying to perfect it. But the hindrance has been their ability to fund these types of projects. And when all of the money was provided for COVID-19 vaccine development, they were able to accelerate this process tremendously in order to get the science completed and to have these huge trials of tens of thousands of people in order to try and let the science apply itself into the populations that we needed it to for this mass vaccination effort that we're undergoing right now. And as I mentioned before, growing the virus in the lab is kind of a little bit more of the historical way a lot of the vaccines have been created. The mRNA technology has been credited for what the future of vaccines, because it's much quicker, it's much easier, and it's a very clean virus and a very clean vaccine, or a very clean vaccine, not virus, very clean vaccine for the community. So it has very few ingredients. And like I said, the mRNA is the primary component, and it's gone. As soon as it delivers its message, it really goes. And so the rest of it is your body doing the work. So it's really just stimulating your body to do all the right things that we need it to do in order to protect ourselves.
Very cool. So our final question, we're getting close on time. So Dr. Key, why does UTC require vaccination? And I also want to add encourage, because I know staff members aren't required to get vaccines, but we are encouraged.
So vaccinations in general are required or encouraged at universities and schools to keep students and faculty and staff safe. The ones that we require here at UTC are the same vaccines primarily required by public schools in Tennessee from when kids start in kindergarten on. So it's not new. They're not really new vaccines. The only one that's an additional vaccine typically for college students is the MCV4 or the Menactra or Menveo vaccine, the ones that are for meningitis. And those vaccines are required primarily because we have congregate living here, residential living. So those are the ones that our students that live on campus have to take the meningitis vaccine. But it's important for UTC in general to require vaccines, or any other university for that matter, because we all live in either close quarters or interacting closely with lots of other people. And that's just a prime setting for disease spread. So requiring vaccines for vaccine preventable illnesses will create a safer environment for the entire community. So here inside of our walls of UTC, but also outside, since we're such an urban campus, we're interacting with the city of Chattanooga on a regular basis. So there are exemptions that people can have. So like Teresa said, not necessarily something that we require for all employees to be fully vaccinated or vaccinated for certain things, or require proof of vaccines for certain things. But for our students, we not only require that they get the vaccines, but that we have proof of certain vaccines. But medical and religious exemptions are valid exemptions here in the state of Tennessee. So if somebody has a religious or is affiliated with a religious group where they do not believe in vaccinations, then they can provide an exemption for that. Or if medically there is some reason why somebody can't get it, like they're allergic to a component of the vaccine, like we talked about earlier, some vaccines are made with egg, egg protein, and you can't have that sometimes if you are highly allergic to eggs or something like that. There are other components. And if you get the COVID vaccine from the health department or somewhere else, they're going to give you a list of the ingredients and say, are you allergic to any of these 8 ingredients? And you're going to look at all of them and you're going to say yes or no. And they're going to determine whether or not you should be able to have the vaccine based on your health risk factors. So one thing that is important to note, if somebody is not immunized against a particular disease, is if they are on a college campus and you have an outbreak of something, they may be excluded from campus. They may not be able to come to campus. They may not be able to live in the residence halls. So let's say we had a meningitis outbreak in a residence hall. Anybody who's not vaccinated for meningitis may have to leave the campus because they are certainly at risk for contracting that bacterial disease or viral disease, and then potentially continuing the spread of it, rather than having people who are all fully vaccinated in the area and potentially safer per se. So that's something to know, and that's something we have to educate our students on. If they are submitting exemptions, they have to understand not only the risks of not taking the vaccine, but also that there could be some potential downsides to it with regard to outbreaks on campus. I did read an interesting article on some college students who were screened specifically about the COVID vaccine. And there were about 1,000 students who were surveyed, and 71% of them believe colleges have the right to require their students to get vaccinated for COVID vaccine before returning to campus. And I was really actually surprised at that. I thought that there would be a much lower number than that might require it. So I was actually encouraged to see that students seem to think that it's okay to require vaccines and new vaccines on top of that. Once this has full FDA approval, I would assume. But I thought it was a really interesting that the students really supported it. And the students really, their highest aversion is social distancing and mask wearing. They supported more mandatory immunizations than they did for a mandatory mask mandate. So I thought that was really fascinating. And I thought, maybe I assumed that it would be the opposite. I'm not really sure what I expected on the front of that, but so students are really, anything that it takes to get back to normal was really what some of their qualitative data was talking about, was they really just want things to be more normal. And if this is what it's going to take to do that, then they would be glad to do it. Right now, though, I should mention that even if you do get the COVID vaccine, you still should continue to do social distancing and mask wearing and all those other safety measures that are required by the campus right now, because you certainly can still get the virus. If you're fully vaccinated and you have 95% protection, you're unlikely to become ill with the virus if you were exposed to it. But if you do become ill with the virus, we don't know what your potential risk for infecting others is. So there's still a lot of that information that's not quite out there yet. We don't know quite enough about the vaccine and how long even that it lasts for. As Dr. Smith mentioned earlier, something that's really important to know about some vaccines, including some of these vaccines that we require for college students for admissions to the university, they require boosters down the road. So your immunity may last for 10 to 15 years, but maybe 15 to 20 years in, you've got some waning immunity. We see that often with our students who have received the MMR vaccine when they're younger. As they go through the health science programs, they have to get titers for their MMR vaccine, and they're oftentimes not immune to one or more of the viruses that are in MMR, and they have to get a booster dose in order to boost their immunity back up to keep them safe and protected from MMR. So it just depends on, kind of where you are in your immunization cycle and how your body handled the immunization to determine whether or not you're immune to certain things or whether you might need boosters. So it's, particularly another one that I think of for is meningitis. You have to have had the vaccine when you're 16 years or older in order for it to be valid for when you're in college, because they don't think it lasts long enough for when you get it when you're 12. So there are important things to know like that. And you want to make sure that if you've got a vaccine and you've had a vaccine, that it's really protecting you. It doesn't help you to get the vaccine if you're only protected for a couple of years and you don't know that you're vulnerable after 5 years or 10 years. So those are really important things to be sure people are talking to their healthcare professionals about as well. And that's why colleges require certain things like that, particularly if you're going to be in a high risk area like a health science program. They require you to get all these titers to make sure that you really are safe to be exposed to these other things that you might be exposed to in the healthcare field.
Very cool. I know next time I go to the doctor, I'm going to be asking about my immunity levels. I didn't know that about the MMR. Well, we have about 5 minutes left. So if anyone has a quick question, feel free to jump on or type in the chat. Otherwise, I want to thank both Dr. Smith and Dr. Key for taking the time to share all this really, really great information. I know I learned a lot. And yeah, any final questions or thoughts, anyone? Donna says thank you.
You're welcome. Thank you guys for having us.
Yeah, this was really great. So we will wrap up. We have our next peek behind the curtain in 2 weeks, I believe. Donna, is that correct? Yes. And so we actually have the Walt Disney Company coming to talk about how they have implemented public safety and healthcare or public health initiatives to open up their theme parks. And so it's going to be really interesting. They're talking about how they're keeping the magic alive during COVID. So definitely join us for that.
Can we be invited to that? That sounds fascinating.
Yeah, of course.
I'd love to hear that.
Yeah, you guys are welcome to attend any events. All of our events are listed on the pre-health YouTube, or I'm sorry, the pre-health website, which is also where our YouTube channel is located as well. And it's just a quick sign up genius. You'll be sent the Zoom link and it'll remind you. But yeah, we hope to see you there. Have a lovely rest of your afternoon, everyone.
Thank you.